If you go back to 1909, I think there's only been 2 or 3 years where a balanced budget has actually been proposed. When it comes to fiscal responsibility, the federal government is atrocious. Just look at Social Security. I'm 60 years old, I've taken money out of my pocket for 40 years because I couldn't save. Well, I could, and all the money you took, you did what you accused me of. You spent it on something else. If my wife has a $300 doctor bill to pay, if you put together administration for healthcare, you're going to have the construction costs for buildings, you're going to have to staff the buildings, heat and cool the buildings, pay your mortgage, and then on top of that, there's graft and corruption, there's no money left. Now, is there graft and corruption in the private insurance? Of course there is. That's the government's responsibility to prosecute scam artists in the insurance. Medicare is broken, and you just want to make things bigger. I have one rhetorical question. Why don't the Russians through in a month? But the money's not going to be there until 2013. That's 4 years down the road. The same thing is going to happen with Social Security. 4 years down the road, the appropriations will not be there. And we're going to find out that they went to ACORN or SEIU. That's worth $5 million. Is since Congress's primary responsibility is fiscal matters. Where's the $2 trillion that came off the Fed balance sheet in November? All of the senators and representatives be screaming up and down, where's that money? That's 1 month of total GDP for the United States.
You bring up a lot of questions, and that is I think those questions are questions that not just members of the public and members of Congress are grappling with as well. Well, let me go talk about a couple of them. First of all, Constitution of the United States. I don't think enough people read it. I don't know if they teach it in school anymore. But you're right that the Constitution doesn't specifically talk about health care. But let me just read for all of us. I think it's a good chance for us to remember what our founding fathers wrote about. It said, "We, the people of the United States, in order to form a more perfect union, establish justice, ensure domestic tranquility, provide for the common defense, promote the general welfare, and secure the blessings of liberty to ourselves and our posterity, do ordain and establish this Constitution for the United States of America." They did a pretty good job. I mean, this Constitution is better. Let me answer your questions, sir. You had a chance to speak, and let me answer some of your questions. So, the balanced budget is something that is imperative. I've talked to you about my commitment, and when you look at my voting record, which I urge you to do, and don't just take my word for it. Don't just take my word for it. Look at, for example, the groups, the non-political, the non-partisan groups that every year tally every single vote from every member of Congress. And from a 0 to 100 scale, 0 being the most conservative, with 100 being the most liberal. In my first year that I served you, I received a 56. 56 out of 100 were conservative to liberal. Last year, I was a 52. So my record is independent, it's bipartisan, it's balancing the budget, and again, that's why I was able to get elected by all of you and to represent you in the United States Congress. The balanced budget is really critical. And looking at this escalating debt and deficit that we have, and the boomers that are moving to the system is something. You talk about Social Security, you talk about Medicare, it's something that is serious, and we are forced to grapple with, and we need to grapple with it as well. The antitrust laws are something that I think even if we can't pass a comprehensive insurance reform bill, we have to do something about. It's interesting that the insurance companies are not held to the same standard as other companies when it comes to their ability to negotiate between themselves and set prices. I think that needs to be changed. That our antitrust laws are out of whack. And don't forget some of the issues brought up earlier. Why are the costs so big? Why are the profits so big? And finally, the 2013 start date. We've got a lot of questions about that. I have questions as to why can't we start this right now? It's so important. Let's get going on it. Well, the reality is that starting in 2010, that, for example, the donut hole. Anyone out there caught in a donut hole right now? I know my dad's caught in a donut hole. I hear about it all the time. We have millions and millions of Americans caught in a donut hole. 50% of those folks immediately will be worse to try to fill that gap because it is so critical. So there's a lot happening next year, and the following year, and the following year. And if you want, the website has a whole chronology of what will happen. Again, I'm not defending 3200. I'm just telling you what exactly exists in the legislation, that a lot will happen towards reform, making prices go down, increasing competition. And let me just talk about, I mentioned donut hole. The inability for the federal government to negotiate the prices for prescription drugs for Medicare, I think is outrageous. Outrageous. We can negotiate through the VA, we can negotiate through Medicaid, but this prescription drug bill, when it was passed a couple of years ago, it's interesting, I wasn't there at the time. It was the largest expansion of any federal program, any entitlement program in the history. Hundreds of billions of dollars. And the public did not come out like it is now. I mean, the public has woken up. Many people spoke out against that. We funded this major expansion, and we didn't pay for it. So now we're borrowing more money from the Chinese, from the Japanese, from UK to pay for our prescription drugs. That's wrong. If we want a program right here in America,